Hi, I'm Steve Adubato. Welcome to a very important program dealing with a whole range of public policy issues. We kick off with Dr. Ashish Parikh, who is Chief Quality Officer at Summit Health, one of the many healthcare organizations that underwrite what we do. Dr. Parikh, let me ask you, first of all, thank you for joining us. We welcome you.
Thank you for having me.
But I want to get into the whole question of vaccine resistance as we tape this program at the end of June 2021. How significant is the resistance that you see, A, and B, what progress are we making in breaking that down? Because we're clearly not where we need to be.
Yeah, so I think that the progress has been very good up till now. However, there is a significant amount of resistance, and I think resistance varies depending on who you are. And we really have to meet people where they want to be in terms of convincing them to get the vaccine. There's certain people who are afraid to get the vaccine because they think there's still not enough data. So we need to give them the data they want. And it has to be what they want to know. Is it safe? Is it safe for my race and ethnicity? Is it safe for my child? So that type of data. There's other folks who need to make it more convenient, right? I don't have the time to go out and get the vaccine at a site or at a pharmacy. So we need to be able to go out to where they can get it without losing time from work or losing time from their families. And there's other people who want to know about effectiveness. I'm not worried about it, but if you'll tell me it'll prevent me from spreading it to my child, to my grandmother, then maybe I'll take it. So we have to find out what it is that's making people resistant to it, and then help them understand it better.
Yeah, one more thing on this, and then I'm going to move to a whole range of other questions, including mental health related issues. But if someone says, quote, it's my right not to take the vaccine, yes, it is. But we had this discussion with State Assemblyman Herb Conaway, who's a physician and also chairs the Assembly Health Committee. And he said, yes, it's your right, but there are consequences of that decision to not just yourself and your family, but others, correct?
Absolutely. I mean, so first thing we have to do is convince people that it's not only good for you, but it's an act of kindness, right? By getting the vaccine, you're protecting yourself, your loved ones, and everyone else around you that you may be exposed to. And while it may be your right not to get the vaccine, it's not right for your community, right? It's not right for even people in your family or people at work that you may put at risk if you don't get the vaccine. As well as obviously, if you get sick, you're burdening the healthcare system with something that's potentially preventable.
Doctor, as we do this program, our daughter is 10. There are many others, who have children not of age to be vaccinated, allowed to be vaccinated, able to be vaccinated. It's going to change, obviously. Well, I don't know, obviously. It appears it's going to change. What, if any, concerns do you have about children under the age of, what is the age right now? Help me on this, Doctor. 12. What, if any, concerns do you have about children under the age of 12 in the vaccines?
So right now, my concern is that these kids are not vaccinated. So the more of us who are eligible get vaccinated, the more we're going to protect them by preventing the spread of the disease. In terms of concerns of the vaccine for these children, we just have to wait and see what the data shows. Thus far, all the studies that have expanded the eligibility have shown that it's effective and safe, even down to 12. And there's large studies going on right now that are looking at ages 5 to 11 and even down to children as young as age 6. And we can extrapolate from a lot of our other vaccine data from what children get that shows that most vaccines are very safe and effective, even at a very, very small age. But we have to wait for the data to determine if there's going to be any concerns in younger.
COVID and mental health related issues. A, what, from your perspective, Doctor, has been the impact? And B, what do we need to do to address these complex, important issues?
So the impact has been huge, and you've heard all kinds of words like tsunami and tip of the iceberg and all these things. I think that over the last 15 months, we've all been traumatized to some extent. And those folks who maybe did not have the coping mechanisms or the support systems to get through it, we're seeing a lot of anxiety, we're seeing a lot of depression, and it's related to either your fears of the disease, your experience with the disease, or even your experience with a loved one who either got the disease or even worse, if you lost a loved one to the disease. On top of that, you add in financial strains, social strains, trouble taking care of children who are at home and missing school. It's taken a huge amount of a huge toll on our society. And then there's folks who've been on the front lines, right, who've been traumatized by seeing the folks who've been suffering.
I was just about to ask you that, Doctor. Go ahead. About the folks on the front lines, clinicians, professionals, healthcare leaders who are dealing directly with patients. What has been the impact on them?
It's been huge. I can tell you, at Summit, we quickly set up a provider support line and staff support line because we saw the toll very early on when our critical care physicians were going in there and seeing their patients dying, despite offering them everything possible. For our folks who had to come in and anxious about bringing the disease back home to themselves. So we've seen this continue, and the key is going to be to identify these folks. A lot of times folks feel like it's a sign of weakness if they admit the fact that they've been traumatized by this. So we have to be proactive in identifying them and giving them the support they need and let them know they're not alone in this.
Doctor, obviously the world of healthcare would change forever because of COVID, but I want to ask you more specifically about telehealth. How significant now, how significant do you believe it will be moving forward?
I think telehealth is a great technology. We've had it for close to a decade now, but the adoption rate had been very slow. I think the one positive thing that's come out of COVID is our ability to understand how to offer it, how to use it, and for the communities to actually reap the benefit of it. I think what will happen is we saw a huge uptick, early on when people were afraid to come in. We're now slowing down, and I think on average around the country, you're seeing about 10 to 15% of visits that are remotely done. I think it'll shake out depending on what specialty, what type of visit you have. Some things like behavioral health may be done almost all remotely, while other things will still need for you to come in. But it's a nice armamentarium to add to our types of visits and access.
Before I let you go, Dr. Parikh, you've said obviously the vaccine is the smartest thing anyone could do for themselves as well as family members, and it's an act of kindness, as you said. But moving forward, are there any other quote unquote preventive measures that you believe each one of us should be taking, vaccinated or not?
Yeah, so I think there's things we learn from this. So anytime you feel like you're sick, whether you're thinking you might have COVID or regular cold, I think it's good to make sure you don't expose others. So wear a mask, right? Or if you're going to go visit someone who you think is sick, wear a mask. Washing our hands before we eat or touch our faces will help prevent, again, not only spread of COVID, but all sorts of other viruses and bacteria. So I think we've learned from this to be smart anytime you're sick to just prevent the spread of the disease.
Dr. Ashish Parikh, who is Chief Quality Officer at Summit Health, I want to thank you so much for helping us understand. People may say, hey, haven't you done a lot on COVID and COVID awareness and can't do enough? Just going to keep doing it with smart people like Dr. Parikh. Thank you, Doctor.
Thank you. Thank you for spreading good information.
You got it. We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, TD Bank, Johnson & Johnson, Delta Dental of New Jersey, New Jersey Sharing Network, Seton Hall University, the Turrell Fund, supporting Reimagine Childcare, the Fidelco Group, and by St. Joseph's Health. Promotional support provided by ROINJ and by AM 970 The Answer.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. Reimagine Childcare, formed by a coalition in New Jersey, is dedicated to improving accessibility, affordability, and quality of childcare and reimagining the way we support these essential providers. Learn more by visiting reimaginechildcare.org.